Most parents think they'll know when their child needs glasses. They imagine their kids squinting at the board in school or holding a book too close to the face or simply just telling them, I can't see far away or I'm having trouble. Here's the thing, kids are masters at hiding vision problems. And the reason is they don't realize that what they see isn't normal because it's the only way they'd ever see. And that's how so many kids slip through the cracks, struggling in school or sports, not because they're lazy or distracted, but because they simply can't see well. Today, I am sharing the 8 subtle signs your child might need glasses, the ones parents often miss, so you can catch problems early and protect their vision. Today, we'll talk about why frequent headaches could actually be an eye issue, the behavior teachers often mistake for attentional problems, why your child's reading speed might have nothing to do with ability, the sports clue that could point to poor depth perception, and how one simple observation could save your child from years of struggle in school. If you're interested in finding out more about these, stay tuned. Hello everyone, I'm Dr. Rupa Wong. I'm a board-certified ophthalmologist, fellowship trained in pediatric ophthalmology. I've been helping kids and families for nearly 2 decades now, and I've seen how undiagnosed vision problems can impact a child's learning, their confidence, and even their behavior. So let's go through these signs, and I'll give you tips on what to do if you spot them. First one, frequent headaches. If your child often complains of headaches, especially after reading, doing homework, or spending time on a screen, that's a red flag you shouldn't ignore. Here's why. When a child's eyes have to work too hard to keep things in focus, the tiny muscles inside and around their eyes stay contracted for long periods. That constant effort can create strain, and that strain can translate into headaches. These headaches often show up in the forehead or around the temples. This isn't just too much screen time. It's a common symptom of uncorrected farsightedness, astigmatism, or a focusing problem called accommodative insufficiency. In some cases, it might even be a binocular vision problem where the 2 eyes are not working well together. Kids don't always describe these headaches the way that adults do. They might say their head feels tight, or it feels heavy, or they may simply close their eyes and put their head down on their desk. And because the discomfort often builds very slowly, they might not connect it to their vision at all. Oftentimes, I see a ton of patients with headache. The majority of the time, it's not from their vision, but very occasionally, it actually can be. So it's worth checking out. Ask your child when the headaches happen. That's a tip. Is it common on school days or on weekends? Do they happen more after reading or doing close-up work versus after sports? The timing pattern can give you and your eye doctor an important clue about whether the problem is related to their vision. 2, losing their place when reading. Parents often think that this is a reading or attention issue, and it absolutely can be. But sometimes it might be an eye alignment problem. If the eyes aren't working together perfectly, kids may lose their place or skip lines or even reread the same sentence over and over. They might even use their finger to track words well past the age of when most kids are going to stop doing that. Now, this can also be a sign of processing issues like dyslexia instead of an eye alignment problem. But the first stop is always to check in with your pediatrician regarding their thoughts and to see your pediatric ophthalmologist to assess if it's a vision versus a processing issue. From there, the appropriate therapies can be initiated, whether it's glasses or eye muscle surgery or occupational and educational therapy. Tip: if this is happening, ask your child's teacher what they've noticed during reading activities. Oftentimes, teachers spot this before parents do. 3, squinting or tilting the head. We all know that squinting is the most dramatic I can't see sign that parents are actually watching for. But here's the thing, in kids, it's not always obvious. They might not stand there doing a big dramatic squint like an adult might. Instead, the changes are often subtle. They might just slightly narrow their eyelids or quick wince when they're trying to see something far away, or just a consistent tilt of their head that they don't even realize they're doing. That's what my older son did. Why did they do it? Squinting clears the way light enters the eye, creating a smaller aperture that can temporarily sharpen the image and reduce blur from refractive errors like astigmatism, myopia, or even farsightedness. It's the same principle as looking through a pinhole with your fingers. The image looks clearer because you're reducing the amount of scattered light. Tilting the head is a little different. Sometimes it's about trying to find the position where one eye sees more clearly, especially if there's an imbalance between the 2 eyes. Or it can be about strabismus. If one eye is trying to adapt to the double vision, the tilt allows the eyes to line up in a way that reduces the double image. The tricky part is that kids won't tell you that they're doing this because they don't know it's unusual. For them, it's just how they look at things, and it's the way that makes things seem a little bit more clear. That's why it's so important to notice patterns over time. So if you see your child consistently tilting their head in school photos or candid shots or while watching TV, that's what my son used to do, or even just when they're doing homework, it's worth paying attention. That habit can be a clue that they're not seeing clearly enough through both eyes. And on top of that, a chronic head tilt can cause neck and shoulder strain if it continues for months or years. Take a quick scroll through your phone's photo album. Look for repeated head positions or that subtle squint. If you see it happening again and again, make a note and bring it up at your child's next eye exam. It's a detail that can really help us figure out what's going on. 4, sitting too close to screens or holding books too close. Now, this is one that all the parents and grandparents ask me about. It's true. Kids naturally just sit closer to things than adults. They like to be involved in the world. Their arms are also shorter, their chairs are smaller, and they like to get in the middle of whatever they're doing. But there's a difference between normal kid closeness and a potential vision problem. If your child is consistently just inches away from the TV, leaning so close to a computer screen that their nose could touch it, or holding a book practically against their face, it could be a sign of nearsightedness, also called myopia. Kids with myopia see up close much more clearly than they do far away, so getting closer to the screen or the page feels natural. It instantly sharpens the image without them realizing why. But myopia isn't the only possible cause. This behavior can also be linked to focusing problems or even issues where one eye is not working as well as the other. For some children, moving closer is their way of making the image big enough for both eyes to process comfortably. The concern with always sitting so close is that it might not just be a symptom. It can also be part of the problem. Spending long stretches of time focusing up close can encourage the eye to adapt to that near setting, and research has shown that unfortunately that can contribute to worsening of myopia or nearsightedness over time, especially in kids who also spend just a little bit of time outdoors. So, tip, the best way to spot this is observe when your child doesn't know you're paying attention. Watch how they position themselves during TV time or gaming or when they're reading. If they always gravitate closer than you'd expect, especially for things that should be perfectly clear from farther away, it's just time to schedule a comprehensive eye exam. The earlier we catch these vision issues, the more options we have to slow their progression and protect your child's sight. 5, avoiding activities that require good distance vision. This one is surprisingly easy to miss because it doesn't show up in the classroom. It shows up in the playground or the sports field or even just at birthday parties. Your child might be an avid reader, might love drawing or great with building blocks or crafts, but when it comes to certain sports, they might want nothing to do with them. And it's often the sports that require good distance vision, like baseball, basketball, soccer, or tennis, that they shy away from. It's tempting to just chalk this up. They're just not athletic or they're not into sport. But sometimes the real reason is simply they can't see well enough to participate confidently. If a child can't see a ball clearly until it's right in front of them, they struggle to judge the speed and the distance. And that delay makes them more hesitant, especially in fast-paced games. And it can make them appear clumsy. It can make them look uncoordinated or even just disinterested. I've had parents tell me they never wanted to play soccer because they were scared of getting hit with the ball. But when we tested their vision, the reason was clear, like literally. They couldn't track that ball at the distance, so the whole game just felt completely unpredictable and unsafe. Once those vision issues were corrected, the difference was remarkable. Kids who had avoided team sports started joining in and actually enjoying them because now they could see the game. Tip, if your child avoids only certain activities, especially fast-moving games that involve tracking objects from a distance, consider that it might be a vision issue rather than just a genuine lack of interest or ability. Bringing up this fact with your eye doctor can be the first step to helping them feel more confident in those settings. Your child might just not be interested in that sport, but it's always good to get it checked out. 6, excessive eye rubbing or blinking. Yes, kids rub their eyes when they're tired. That's perfectly normal. But when eye rubbing happens frequently during the day, especially during activities that require sustained visual focus, like reading, writing, or using a screen, it can be a sign that something more is going on. When the eyes are straining to focus, the muscles around them get fatigued, and rubbing may feel like a quick way to relieve that discomfort. But in reality, it's just a temporary sensation. And sometimes rubbing can even make things worse by irritating the surface of the eye or introducing a foreign body or an infection. Frequent blinking can also be a clue. It might be the body's way of trying to refresh the tear film when the eyes are dry, or it can kind of be this very unconscious attempt attempt that kids have to clear the blurry or fluctuating vision. They think that by blinking, it's going to make it better. It's often also linked to dry eyes or allergies or uncorrected refractive errors like farsightedness, nearsightedness, or astigmatism. Here in Hawaii, I see a lot of kids who spend hours in air-conditioned classrooms, and that lowers humidity and it dries the eyes. And then they go straight to screen time after school. So that combination means their eyes are getting very little rest from up-close work. And that kind of stuff gives you low blink rate activities as well. So tip, notice when rubbing happens the most. Is it during homework, when playing on a tablet or a phone screen? Is it during bright sunlight? Keeping track of patterns like this can help your eye doctor narrow down whether the cause is dryness, allergies, or focusing problem. 7, covering one eye or turning the head. This is one of the biggest red flags a parent can spot, and it's often something you'll notice in photos during reading or when your child is trying to see something far away. If one eye isn't seen clearly, maybe because it's weaker or it's out of focus or misaligned, the brain has to work much harder to combine the images from both eyes. This is going to lead to blurred vision and sometimes even double vision in kids. And so to avoid the confusion, the brain does something remarkable. It just shuts the eye off. It shuts off the input from the weaker eye. And so for a child, this is happening without them even realizing it. They might instinctively cover one eye with their hand or close it completely or turn their head so their stronger eye is doing most of the work. That head turn or head tilt changes the angle of vision in a way that makes things easier for the stronger eye to focus. Some kids will even just squint in bright sunlight. This behavior can sometimes be called a lazy eye or amblyopia. It's an eye muscle imbalance. It can also happen if there's a significant difference in prescription between the two eyes or if there's something called strabismus or misalignment of the eyes. The key good thing to remember is that these conditions are far easier to treat if they're caught early. The brain's ability to rewire itself to use both eyes together is highest in early childhood. So that's why we aim to diagnose or start treatment before the age of 7 or 8, even 3 or 4, if possible. Improvements later are still possible, but it does become more challenging. So tip, if you ever notice your child covering one eye when reading or turning the head in a consistent direction when watching TV or squinting one eye in bright light, don't wait until their next routine checked up with your pediatrician. Make an appointment right away. Early intervention can really make all the difference, especially for their vision development. And the last one, 8, trouble in school that doesn't match effort. Sometimes the first sign of a vision problem isn't visual at all. It shows up in school performance or behavior. A child can be bright, curious, and totally capable, but if they're struggling to see clearly, even just simple classroom tasks can become exhausting. They might start falling behind in reading comprehension or avoiding homework, but just finding excuses to leave their seats. So some kids will even act out in class, not because they're defiant, but because they're frustrated and try to avoid situations where they can't see well. This can be incredibly easy to misinterpret. I've had parents bring in their child after months of academic meetings or testing for ADHD or learning differences, only to discover that the root problem was vision. That's not to say these other things can't also coexist. They absolutely can. But the best thing to do is to get your vision checked first before proceeding down the route of processing disorders. A lot of times, kids might just be zoning out because the vision is blurry. It's hard to stay attentive in a class if you can't participate because you just can't see. When we had a kid, I diagnosed her nearsightedness. I gave her glasses. The mom had thought that she was zoning out. It was like night and day. She was able to start participating in classroom discussions. She was able to go into the advanced math classes. And it wasn't because of a discipline strategy. It was literally because we removed the barrier that was making learning hard. Tip, if your child's teacher says if they seem smart, they're just not performing, or you notice that homework leads to tears or meltdown, don't assume it's purely academic or behavioral if you have not gotten an eye exam first. So put that comprehensive eye exam on your to-do list. Your pediatrician should recommend it as a first stop. All these patients end up seeing me first if they are considering a diagnosis of a learning disorder. So if you spotted one or more of these signs, here's your next step. Schedule a comprehensive eye exam, not just a quick vision screening at the school or the pediatrician's office. You want to look for a pediatric ophthalmologist or an optometrist experienced with kids. Bring notes on when you see these behaviors. Is it during homework? Is it during sports? Only at night? On the weekends? That's going to help guide our exam. So to recap, 8 signs that your child might be glasses: frequent headaches, losing their place while reading, squinting or tilting their head, sitting too close to screens or holding books close, avoiding sports or activities that require good distance vision, excessive eye rubbing or blinking, covering one eye or turning the head, or trouble in school despite good effort. Vision problems in kids aren't always obvious, and the sooner we catch them, the easier they are to fix. If this video helped you, please hit the like button so more parents can get this information, and please feel free to share it with your friends. And tell me in the comments, which of these signs have you seen in your child? And make sure you're subscribed so you can get the most up-to-date eye health information every week when I put it out. Thanks for watching. I'm Dr. Rupa. Bye for now.